Quantum physics reveals that the observer is not a bystander, but the force that determines the state of a system. To survive the next major healthcare crisis, we must apply this same logic to how we identify and manage illness. By 2030, antimicrobial resistance is projected to make routine infections lethal, rendering the current supply of antibiotics ineffective across the globe. Adapting to a post-antibiotic world does not require a new miracle drug. It requires shifting the primary point of medical observation from the clinic to the individual. Our brains do not see the world, they render it. Reality is an internal simulation generated from raw sensory data to keep the organism functional. This rendering relies on specific mechanics. Perception is a controlled hallucination. Particles exist in superposition. The universe lacks intrinsic color. Reality is observer-dependent. Furthermore, synchronicity links experience. Sensory inputs are compressed. Quantum foam creates thought. The thinker is an illusion, and observation alters the system. If the state of a system depends on the perspective of the observer, then a model that removes the observer from their home and places them in a hospital reacts to a crisis after it has already changed. This crowded waiting room represents a failure of observation. It treats patients as passive data points rather than active observers of their own biological state. This model centralizes information and creates a dependency on hospital-controlled algorithms, forcing patients to surrender their agency to a system driven by institutional protocols. The physical result of this centralized triage is the amplification of superbugs. Forcing infected individuals into medical hubs turns hospitals into vectors for transmission. With antimicrobial resistance linked to 10 million projected deaths annually by 2050, the doctor-centered triage model is no longer a logistical necessity. It is a biological threat. Dr. Srivatsa's Dr. Maya system localizes medical observation. It uses an AI interface, giving patients the tools to observe their own symptoms at the source. The triage logic uses color-coded risk. Red indicates a high-priority emergency requiring hospital intervention. Yellow signals a self-limiting condition, manageable at a local chemist. The blue code identifies an infection, triggering mandatory home isolation to prevent the observer from entering a clinic and spreading pathogens. By isolating at the point of first observation, the system can reduce unnecessary healthcare traffic by 80%, protecting both the patient and the remaining efficacy of our antibiotics. When patients travel to hospitals to be observed, they spread the very infections we are trying to contain. Centralized triage cannot scale to make the speed of drug-resistant bacteria. The most effective tool for survival is a patient empowered to observe their own health. We must isolate at the source to protect the human ecosystem.